Your family, your health, our passion. This is Family Practice with Dr. Jeffrey Fox, sponsored by Family Practice Associates of Lexington, PSC. Visit us at fpalex.com and like us on Facebook.
Welcome back. This is our community resource section, and my next guest is Shelby Bass, who's with the Willows at Hamburg. Thank you for coming in.
Thanks for having me.
Now, the question we have is when do you know if someone needs a nursing home? And I use the term nursing home, and that's maybe not necessarily a good connotation, but there are some times when people really need them.
Yeah. So it's kind of a multifold question. Some people will need a nursing facility if they've been sick or have had to have surgery and they need inpatient rehab to get back to where they were prior to that. And then there are also times that there's been a gradual progression with their diseases and other factors to where they're not able to be at home by themselves, or their current arrangement that they have is no longer safe and working out.
There are different levels of care, though. You kind of mentioned two there.
Yeah. So skilled nursing is that highest acuity of care. That's what folks typically think of when they think of nursing home. That would be for someone who's not really able to do anything independently and they need a lot of extra nursing support, whether it be due to a feeding tube or even wound care. Assisted living is where someone may just not be able to manage an upkeep of their home anymore. They may need medication management, but other than that, they're able to be independent throughout their day, where we would just be there for extra support if they were to need it. And then there's also memory care for those who have the diagnosis of dementia and Alzheimer's and need a more structured day-to-day to help keep them functioning and at their top.
Well, there's different levels of care that you just talked about, but there's also different services. I know because I have had some family members there. I know you got a hairdresser out there.
Yes.
What are some other things that are?
So we are contracted with a wheelchair taxi to take folks to and from doctor's appointments. We also have a wheelchair van. That's the facilities that our life enrichment team will drive to take them to different activities. They'll go to the movies, they'll go out and eat, they'll go shopping. Our residents get to do everything that they were doing at home within the walls of our campus. So nothing really changes on what they are able to do. The particulars on how they may do it may change a little bit.
You also have respite care, and for caregivers, it's really tough, sometimes tougher on the caregiver than it is on the patient. So respite care, tell us a little bit about that.
Yeah, so respite care can be really good if a caregiver is experiencing burnout, and that's just from being the primary caregiver 24/7 to someone. Respite care can also be used if someone is independent prior and they're having an outpatient surgery, but they may live alone and they need a little bit of extra support for a few days before going back home. Or if the caregiver is going out of town or have some medical issues of their own coming up to where they need to know that their loved one is in a safe place.
All right. Briefly, insurance coverage is kind of a surprise to some people.
Yeah, insurance coverage is always a hot topic. So Medicare is for short-term rehab. That would be if someone has an illness, injury, surgery that requires them to have inpatient rehab before going back home. Medicaid is for long-term care when funds are no longer available. Other than that, it's private pay and long-term care policies.
But Medicare doesn't cover long-term, which a lot of people are surprised to hear. How long is an average stay, you think?
It honestly depends. We have had folks who have been with us 5+ years. We have had folks who have been with us a year or two. It honestly kind of depends on how quickly we get them and what their diseases are. So that can vary. But generally, I would say around 2 to 3 years.
Okay. Well, thanks for coming in. Thanks for the care you give the patients, and we appreciate it.
Not a problem. My pleasure.
And thanks to you all for watching, and you can watch this episode or prior episodes through the Family Practice Associates website at fpalex.com and go to the YouTube channel. Again, thanks for watching and join us next month for more great healthcare information on family practice.